Hi, I'm Dr. Donna Robinson. I'm the owner and the founder of MedConsult Clinic, and I've got the Thai medical license and the British license. I'm here today to answer some pressing questions from the internet, so let's jump straight in. Let's look at the first question. Oh, this is an easy question. Sarah asks, should I bother getting a flu vaccine? Of course, it makes sense. We see a lot of young and old school teachers, and they're working with children and they say, oh, there's flu in the school. The main outbreak of flu in Thailand is between May and September. And even last week in the clinic, we did the flu test and we found there's 4 cases. So yes, getting your flu vaccine makes sense to prevent flu. And the thing is, after flu, you can feel really run down for about 2 weeks afterwards. And if you've got serious medical problems, it really will affect your health. Definitely, it's worth getting the flu vaccine. Okay, next question. Oh, Tom asks, as I get older, I have less and less energy and less desire in other areas. What options do I have? Well, I think Tom is asking about testosterone. Often patients don't tell you what they're thinking about. And sometimes they'll say to the nurse, look, can you just add on testosterone test? So how would you know if you've got low testosterone? Well, women's hormones decrease with age, and men, their hormones decrease with age too, the testosterone. So they may feel lack of libido, erectile dysfunction, loss of hair, dry skin, fatigue. So the first thing to do is to check the testosterone level. Of course, there could be other reasons why you're feeling so fatigued. And of course, if you're overweight, you've got sleep apnea and other conditions, these can also make you tired, but also cause a decrease in the testosterone. Come and get it checked. And then if it is low, there are guidelines to follow and other blood tests you need if you think you want to start some testosterone replacement treatment. And actually, it's largely injections. They are the most popular. Let's get to the next question. Change of subject. Jenny's asking, I'm thinking about getting Botox to get rid of my wrinkles. Is Botox safe? Of course Botox is safe. It's botulinum toxin, and it's tiny, tiny amounts that are injected into the muscles or the skin. And we always ask people, where is it that bothers you? Which line? What do you want to change? And they'll say, oh, I don't like this, my frown lines. Some people say, I don't like they call it crow's feet, my laugh lines, different words. Some people say, I don't like my forehead lines. Botox is a quick, very straightforward treatment that anybody could take. There's maybe one medical exception. So, as always, if you've got questions about Botox, wanting to look more beautiful, don't we all? Then just come along and speak to us, speak to the doctors. We've got aesthetic doctors round the clock in the clinic too. Let's get to the next question. So Travis asks, I think I may have an STI. Should I get checked out, or should I just wait and see if it gets worse? Well, of course, you should have it checked out and treated because, for example, with chlamydia, 50% of chlamydian men doesn't have any symptoms, and even 70% of women having chlamydia has no symptoms either. So getting the test's really important. There's different STI tests now. There's even 15 can be tested at once, and they can all be treated, and you should get as much information as possible. The tests aren't painful, either a simple urine test or a swab, and you can do those tests yourself. But you can even buy self-test kits. So the most important thing is come and see us, get some information, and we can help you. Let's get on to the next question. Mark asks, I'm looking to lose weight. What would you recommend? Well, this is a very common question, but of course, everybody's trying to follow a healthy lifestyle, exercise, eat the right foods, but we realize medical treatments are needed, and I'm going to discuss some of them for you. Clearly, you've read about Ozempic, the injectable that's once a week, which is super convenient. Then there's the Saxenda liraglutide that's given daily injections. Oh, here's an example of how it's done. So you just give a click and a small injection like this into the skin. Some people just don't like injections at all, so needles. So they would rather have the oral form of the tablet called Rybelsus, and you take that every day. There can be side effects. Let's get on to the other options. There's phentermine. That's another weight loss appetite suppressant that's been around probably for 40 years, and you take that daily. There's also other weight loss treatments like Orlistat, which prevents fat absorption from the gut. There's mesotherapy, which I think you see advertised a lot at clinics in Thailand. This is injections into the fat, wherever your fat is actually. It could be here, or it could be here. And you have injections of this. It's produced from vitamins and minerals and amino acids, and very safe. The final treatment I'm going to mention is fiber. Again, you can understand if you take fiber tablets, fiber supplements, it will reduce the absorption of fat and make you feel full. So everybody's different and has choices, and you may have underlying medical conditions. So it's important to consult with a doctor and get as much information as you can. That's all for today, and thank you to Greg and the British Chamber team for producing the video. And if you've got any questions, you need any help, we're here 7 days a week. We're in Sukhumvit 49 with our doctors, nurses, pharmacists. Just reach out. Thank you very much for watching the video.